A medical doctor, Ngang Cyprian, has made history as the first person to receive the COVID-19 vaccine in Nigeria. This is coming on a day the country kick-started the COVID-19 vaccination at the National Hospital in Abuja, with the Frontline health workers taking the lead. The event, led by the Ministry of Health, National Primary Healthcare Development Agency, and the Presidential Task Force on COVID-19, will be rolled out in phases across the state, including the FCT, which will have 65 vaccination points across all council areas. TVC News correspondent Kemi Balogun reports.
Finally today, the first batch of the Oxford AstraZeneca vaccine shipped in on Tuesday is being put to use in the first phase of vaccination for citizens. Top on this list are healthcare workers and supporting staff who have sacrificed valuable time and expertise to save lives. Cyprian Ngong has just made history as the first Nigerian handheld worker to get the vaccine.
Well, there was just a slight pain, like a pinch, like a mosquito bite right there. The same way you get if you get a needle prick, and that's all.
Cyprian and many others getting the jab today have been at various isolation centers since the outbreak of the pandemic in March.
It's your body to build immunity to resist the infection.
A vaccine that has gone through all the rigorous processes that you normally take before you certify a vaccine fit for.
The Secretary to the Government of the Federation, Boss Mustafa, who also doubles as the chairman of the Presidential Task Force on COVID-19, says the aim of this process is to vaccinate at least 70% of Nigeria's population between 2021 and 2022 in order to get a grip on the pandemic.
We must recognize that vaccine hesitancy will impact negatively on our lives and those of our loved ones if allowed to foster. 4, we must demonstrate at all times that this is a war of MPIs plus vaccines for the survival of everyone.
This first process and rolling out of vaccines begins with this pilot phase at the National Hospital in Abuja being the starting point. It will be replicated across other states and across the FCT, which has already set up 65 vaccination points across all area councils.
All eligible groups must get vaccinated as and when due, while the non-eligible groups should respectfully await their turn. The vaccines are more than enough to go around, and they'll be coming in phases. The defined frontline healthcare workers are prioritized globally for vaccinations against COVID-19 due to their higher exposure to the risk of infection with COVID-19 in the course of duty.
We took all of the measures that were required, more measures than many countries took when it came to selecting the vaccines for Nigerians. The vaccines that we're going to be delivering today to Nigerians are safe, they're effective, and we're going to roll out this vaccine in a very efficient manner.
The TEACH strategy was launched a few days ago to provide a backbone for distribution and data collection for the distribution of vaccines. The electronic registration portal, also created to help Nigerians register their name to get dates, will also be done in badges. Health workers have played and will continue to play a critical role in the entire COVID-19 response globally and even in Nigeria, and their service will continue to remain important as long as the pandemic remains with us. Kemi Balogun, TVC News, Abuja.